to order, and I'll start out by asking people to introduce themselves because there may be people online who don't know us, although I think we're getting to know each other pretty well now. But I'll start. I'm Kay Leach, and I'm the current chair for the Board of Health. Penny, you want to go next?
Certainly. Penny Cottle, I'm the administrator at the Health Department.
Margie, you want to go next?
Sure. I'm Margie Rice. I'm an attorney for Monroe County Government.
Okay, how about our board members next? Steve?
Steve Pritchard, board member.
Bob?
Bob Wren, a retired physician, board member.
Carol?
Carol Tolukian, retired pediatrician, board member.
George?
George Hageman, retired microbiologist from IU and board member.
Okay, how about our IU friends? Leslie?
Hi, my name is Leslie Fasone. I'm the Assistant Dean for Sorority and Fraternity Life at IU.
Okay, Kathy?
Hello, everyone. Kathy Adams-Reister, Associate Vice Provost for Student Affairs and Executive Associate Dean of Students at IU.
Okay, and Mark, one of our board members, has just joined us. Mark, you want to introduce yourself?
Certainly, yes. Mark Norrell. I'm a Board of Health member, and I'm Senior Lecturer in Healthcare Management and Policy at Indiana University.
Okay, and I think Graham McKean is here from IU. Is that correct? I can't see you, and I see Dave. Graham, would you want to introduce yourself first? Maybe Graham's not here. Dave?
He's muted also.
Okay. Yes, he is. Dave, you want to go ahead and introduce yourself, and we'll see if we can get Graham unmuted.
Yes, thanks, Kay. Hi, I'm Dave O'Gwyn. I'm the Vice Provost for Student Affairs and Dean of Students at IU Bloomington. Thanks for having us again.
Pleasure. Our technical person, is it Michelle tonight?
That is correct.
Michelle, could you see if you could unmute Graham McKean?
I sent him a request to unmute, but he has to press a button. So if he's having technical difficulties, that might be why.
Okay, thank you so much. Well, we'll let him introduce himself later on if he can get on. Anybody else there that we should introduce? I see somebody, but I don't. Nope, that's all I see. Okay.
That's everybody.
Okay. Next is public comments. Do we have anybody that's joined us in the public that would like to make a comment to the board tonight?
There's one hand raised. Well, yes, one hand raised, Christina Armour.
Okay, Christina, I'm going to let you make comments, but I want to tell you first that we allow 3 minutes for the comments, and our technical person, Michelle, she will give you a warning, a little bell, 30 seconds before your time is up, so you'll know how to summarize. So if you would go ahead and give your comments, it's a pleasure to have you here tonight.
Thank you. We'll do our very best. This is my husband.
Hi, my name is Michael Black. We own the video saloon in the Cade and Black's Market downtown. And I know most, you want us to go ahead and talk now, or do you want us to wait until you've introduced?
You can go ahead and just give us any comment that you want us to know about.
Okay. It's, I think I've timed it, so we'll be pretty close. Okay. Many of our retail stores are closing. What would Bloomington look like with only chain restaurants, bars, and no live entertainment? During these months, while our businesses have been shuttered or restricted, we are still obliged to pay rent, utilities, fees, and taxes. Those of us that remain don't have much left in the tank. When all but essentials were closed in March, it was scary. We were encouraged when we were allowed to reopen in June, but we were surrounded by uncertainty. The COVID threat had in no way diminished, and there was no consistent information or guidance. Government agencies weren't communicating with us or with each other. Panic buying, supply chain disruptions. How do you reopen a bar without toilet paper? We had an employee meeting, mapped out a plan, and we went ahead and reopened. But it didn't go well. The patrons had zero respect for the virus. Every day looked like Times Square at the end of World War II. A great weight had been lifted off of them. They were free again. But our staff was terrified. There was no vaccine. There was no therapeutic. We could not even get a mask mandate. It was like Russian roulette. So after 2 weeks of chaos and desperate pleas from our employees, we closed. It just wasn't safe. Finally, we got a mask mandate. We felt safer and reassured. We were getting answers. We had PPE and TP, but the administration was saying one thing, the state something else, and Bloomington something else still. We had some rules to go by. We had some CDC guidance, so we moved ahead. Everything was running smoothly, although slowly hobbled by capacity limits. We could still deal with this, but then the students came back. They don't listen, they don't care, the rules don't apply to them, and they want to be in charge. After all, they own this town. It was like amateur hour. Confirmed cases quickly multiplied, restrictions tightened, only a matter of time until we would all get shut down again. But then, just like at Camp Granada, the sun came out. Positivity rates were going down. IU got hold of the problems with the campus. The fatalities had stabilized. Wash your hands, avoid crowds, practice the gold standard. 2 masks, distance, we can do this. And here we are today, but with concerns. In today's retail environment, you walk in masked. You walk up to a counter which provides distance. You tell the clerk what you need, she's masked. You get your order, you leave, or you sit down, depending on the type of business. That's how we all do it, all day, every day, nationwide. It's exponentially safer, at least according to the CDC, than sending our employee to a table of unmasked patrons. In addition to that, our transactions take under a minute, start to finish. Worried about lines? There are no lines. We handle it the same way as the airlines handle passengers using the restrooms. 1 at each station, 1 queued up, all distanced. Everyone standing is masked. Everyone else remains seated. We can serve 250 per hour with an occupancy limit of only 100. That means we could serve everyone 2.5 drinks an hour, and we certainly won't be doing that. 1 is plenty. Reducing our customer count to under 20% capacity greatly increases the available cubic feet of air per patron while freeing up personnel to focus on compliance. We constantly filter our air and replace 20% per cycle with fresh air. Following the lead of the Bluebird, we will be adding ionization purifiers to our 5 HVAC units. Compliance officers, while expensive, will give you a firsthand account of our operation, and we welcome that initiative. Thank you for your time.
Thank you so much. And we do recognize how difficult this has been for everyone. Anybody else out there that wants to give comments? Michelle, anyone else out there?
There are no other hands raised.
Okay. All right, next is approval of the minutes.
I apologize. One hand did raise when I was saying that.
Okay.
Would you like it looks like it's on a Samsung Galaxy phone?
Okay. Could that be Graham, perhaps?
Hi, can you guys hear us?
Yes.
Hi, this is Jeremy Black, son of Michael Black and Christina Armour. This is my wife, Chelsea Black, with us. And we have a 3-minute statement we'd like to make.
Go ahead.
Okay, so our statement is regarding the bar service in particular, and I just want to point out that we do not want seating at the bar top. This is mainly just for wanting service to be provided at the bar as far as serving drinks. And that's primarily based on the CDC's recommendations regarding masks and their ability to help prevent the spread. So it has been shown that when all interacting parties are wearing masks, the probability of contraction is minimal to non-existent. When our staff approaches a seated table of potentially up to 10 unmasked customers, as stated in the current health order of July 22nd, paragraph 2, section J, their chances of contracting the virus rise significantly when there are around 10 other people who are unmasked, yet they are masked. That still does not mean that they will be unaffected. If one customer from each table were to come up to the bar masked and order drinks from a bartender who's also masked, we would see that our staff's risk of contraction is significantly lowered, such as that described by the CDC's findings and recommendation. Once again, if everyone approaches the bar from either side, customers or bartenders, and they're all masked, this greatly reduces the probability of contracting the virus, which that point was made so for the concern of customers interacting with each other. So this could work if each bar had a designated ordering station like we see in gas stations, fast food, like we see at other restaurants who don't have tables available right now. Each bar would have a designated ordering station. Then we would have queue lines following that, indicating adequate spacing between those waiting in line to order drinks. As I think Mike had mentioned, our ability to serve drinks quickly is very high, considering normally we're a high volume bar. Of course, we're not that right now. So in our case, with our line length restrictions, we would only have about 3 people in line at a time. And our ability to serve all of those people within less than 10 minutes or even 5 minutes, if we're counting a minute and a half per person, they would all be served well within that time limit. So basically, we just want to be able to serve people at the bar like you would see people waiting for a restroom on an airplane. If there's not enough line, if there's not enough area in line for people to wait, then they take their seats and wait until there is enough space in line for you to come up and order your drink.
Mask to mask.
Mask to mask. We, have been in this community for 40 years, and we just want to stay relevant and also keep everybody safe. If we don't do this, then there may be unsupervised gatherings outside of the bars that we don't have control over, and the spread of the virus may become even more uncontrollable. Thank you for your time.
Thank you so much. Okay, anybody else online? Michelle?
Now there are no more hands raised.
No more hands up. Okay. Okay, let's look at our minutes. Everybody got a copy, I'm sure. Any corrections? Mark, did you find any errors? You're the one that's really good at wordsmithing it. Okay. Do I hear any motions?
I'd move to accept the minutes.
I'll second.
Okay. Did you get that, Penny? Who was first and second? Okay. All in favor? No, I have to call one by one. George?
You're muted, George.
Matt? Yeah.
Yes.
Yes.
Okay, that's a yes. Okay. Mark?
Yes.
Steve?
Yes.
Carol?
Yes.
Dr. Wren?
Yes.
Bob? And I will go with yes also. So the minutes are approved. Okay, next is our public health reports. The public health clinic.
Good afternoon.
Hi there, Amy.
Hi, Amy.
Hi, I'm just coming in from a flu clinic, so thank you for a few minutes late.
Thank you for those flu clinics.
Yeah. So I'll just give a quick report of the public health clinic. Typically we do around 15 to 20 flu clinics each fall, most of those being in the schools. Right now we have, I think we're up to 57 scheduled. I think this was number 36 that I just came back from. So we've been doing a lot of flu clinics, really putting those efforts in to help the community stay free of flu during COVID right now. And part of the reason we've been able to do that, the IU Health Hospital has purchased a lot of flu vaccine that we're able to access for free. So we're taking those free vaccines to the public, but we're also taking them to Shalom and to Wheeler and a Middleway House and New Hope and all the shelters, trying to make sure people that maybe have lower access to vaccinations can get those in a really convenient way. Right now we have an intern working with us. She is compiling the whole region's data. So all of the data that is really public facing, but making that in a way that we can look at Monroe County, but also the 11 surrounding counties and see any trends. She compiles that each week, and I forward that on to Penny so we can kind of see if there's maybe higher positivity rates in counties neighboring us, things like that. Just to give you a little update on the public health nurses and some of the responsibilities that they're carrying out right now. Right now we're carrying a phone 7 days a week. The nurses are taking turns manning that phone, and that number is given out to all of the schools and to all of the shelters. So if there's any questions that come up, they have someone they can call. They filled a lot of phone calls from the schools, just trying to help with contact tracing and working through dates and things like that. We're also supporting the safe recovery shelter. So as someone is admitted to that shelter, they have to have a COVID test. So we go out every day when there's someone who's admitted and do that COVID testing there on site. That prevents them from needing to come to the emergency department just for a COVID test. And really, that's all I was going to do, is give you just a quick update on what's happening right now. And I can take any questions if you have them for me.
Does anybody have questions for Amy? Amy, it's so good to see you again and hear about what else going on. So thank you so much for being with us tonight. We appreciate it.
No problem. Thanks.
Okay. Public health clinic. Anything else?
That was Amy. Yeah.
Okay. That was Amy. Okay.
Yep.
Okay. Penny, anything from administrative that you want to give us a report on?
Sure. And I will just say, a shout out not only to all of our staff, but Amy and the nurses, because they have been overwhelmed since spring when this started. And you can just imagine their normal workload. And then you put contact tracing, and we find that we keep getting more contact tracing kind of put on us from the state. And just all of the different questions and those kinds of things. And then doing all of these flu shot clinics. And of course, we're planning for vaccine clinics early next year. So lots going on, and they are fabulous teams. So shout out to them.
Absolutely.
Yeah.
This is Dr. Sharp. Let me add, Penny should be included in that list. She's put in incredible hours and effort here.
It's a team effort. We're all doing it. Christina's doing a great job too, and I'll talk about some of that. Everybody really is doing over and above what they normally do. So our numbers are increasing while our positivity rate in our county is good. It's 2.68% today. We're pleased with that. And if you look at our county and look at our surrounding counties, we are doing much better than others, but that is not to say that we are not concerned about our numbers. Our daily positivity rates, our numbers are increasing. This week, our rate per 100,000 was 154 cases per 100,000. And that's up. So it's going in the wrong direction. There for a while, it was going down, and we were really pleased and hoping, if you're looking at that metrics map, the color-coded map for the state, we were hoping we would be going to blue, and now we're just, at this moment, I would say I'm happy that I'm still in yellow. And when I'm looking at these numbers that are going up each day, that we're seeing, not 20 or less, but we're seeing 20s, 30, our average right now, I think, is 37 a day. But the last couple of days, we've added 40 or 50 cases. So we could very easily be orange next week. And it really does say that I think the numbers that we've had and the reason that we look better in comparison is because of the different things that we're doing in our community. And we certainly need to stay thinking forward in terms of how do we maintain those. We are continuing to take feedback, and we appreciate the feedback tonight and the feedback last week. We met with Greek organizations, and we'll talk more about that. We appreciate all of that feedback so that we as a department and you as a board can work with our mission of public health and protecting and promoting and improving public health while considering all of these other impacts that a pandemic has on people. So I just wanted to share those numbers. some general health department things. As you know, we had permission to post the financial manager position and to do that this year. So that's been posted. We have several good resumes in, and I'm just trying to figure out exactly how I can get those interviews scheduled. So those are on the docket, and hopefully we'll get those interviews completed in the next week or two and have that person on board by the end of the year. So we're happy that that's moving forward. The other two positions that are in our 2021 budget, we will be working on those job descriptions. We have to develop those. The environmental health position will be pretty simple. The other one's going to take a little more development, I think, and because there's so many different things that could go into that one. So we'll be taking those to the council through their PAC process for doing that next year. But we'll work on that. As soon as we can get a little bit of downtime, we can get those things rolling and do that. We had posted a disease intervention specialist. As you know, one of our people moved to Illinois, and we were sorry to see her leave, but we have made an offer, and that person should be starting in that position mid-November. So we're excited to have that person, and I'll introduce them once they get on board for us. The community testing site is making headway, and we hope to have that up and going soon, probably by the middle of the month. We haven't settled on an exact date yet, but we hope to have that announcement out soon. We had to do some construction on the site, and there has to be a ramp built for ADA accessibility. So that's in process right now. And Christina and others have put in countless hours in making sure that that all happens. And again, we're grateful for the partners with that. IU Health Hospital, Indiana University has pitched in on that. It's amazing. The city of Bloomington, and of course the commissioners have committed to making sure that that happens as well. And we did get some grant funds, and along with those grant funds, some supplies, the testing, the courier service, those kinds of things. So that will be up and going soon. The Optum site is scheduled all throughout Indiana through December. And then we'll find out if they stay on into the new year or not. So we're glad that we're going to have additional testing, and the Optum site's going to stick around for a little while. We're pleased about that. I mentioned that we met with the Greek organizations. Amy also talked about the flu clinics. We have a drive-through clinic on November 19th from 12 to 3 at City Church. And so we're excited about those things, and it will be a good opportunity for our staff that have not experienced points of dispensing or outbreak clinics, drive-through clinics, to get that experience. So we're looking forward to that. And I think that that's my highlights that I wanted to share, unless there are questions.
I have one question, Penny. Have they started construction down in our old building, or the downtown?
Oh, yes. Oh, yes. It's coming along quite nicely. And you know, I know that we won't be moving. I would be shocked if we were moving in as planned, you know, between Thanksgiving and Christmas. But I expect that it will be ready early in the new year. And it is coming along. It's going to be extremely nice. Very, very pleased. The walls are up. And you know, all the new HVAC system is in, and starting to do the drywall and those kinds of things. So we're very excited about that new space.
We can't wait to get back down there.
Yes.
Does anybody have questions for Penny?
Yes, Penny, you mentioned the low positivity rate, but concern about an uptick. And I'm wondering if the low positivity rate is maybe a little bit of an artificial thing because of the university's volume of mitigation testing. Is that mitigation testing sort of creating maybe an artificially low positivity rate?
Well, it certainly could be, and that's a concern. That was always our big concern. You know, when we had that kind of spike because all those negative tests weren't in there, we kept saying, you know, our bigger concern was that we would have a false sense of security. But it's also, as I've talked to some other communities, I was on a call with the other Big Ten communities, and it doesn't seem like such an anomaly for sometimes to have a low positivity rate and a high infection rate, or vice versa. Some of them have expressed that they've encountered that as well. I'm not an epidemiologist, and I'm sure that there are some other reasons that might be occurring, but definitely that's one concern that I have, is that could be somewhat artificially low. And either way, it's a reminder that we don't just look at one piece of data, that we look at multiple pieces. I've used it to describe it as a puzzle, and we try to put all the pieces together to get the real picture. And I think that that's a good example of why you can't just look at one piece of information.
Thank you.
Anybody else?
Well, you have to keep in mind that part of that rate is high-risk individuals. So, and then the other is just random. So it's random plus high risk equals that rate. So not a totally, it's not a gimme that it would, but that's why it's slightly higher than the usual, because it's high risk.
And how much do you think COVID fatigue is fitting in there?
I think a lot. We really aren't finding like big events or, certain things. I know some of the other communities are seeing an uptick again in long-term care. Again, kind of congregate settings, it's easy to spread. And it's typically brought in by workers who unknowingly bring it in, and then once it's in there, it's hard to separate people and maintain that safety. But I definitely think that there is an element of that fatigue, that people are tired and they're wanting to meet with people again, and they're not necessarily taking the same precautions that they need to take because they are with friends or they're with family. Dr. Box got infected, and they think that it came through, daycare center with her grandchildren, but she said publicly that she felt like she kind of let her guard down around family, and maybe that wasn't the best thing for her to do.
I think there's personal COVID fatigue, like things that we all individually get sick of, but I think there's public policy fatigue as well. If you think back to the very beginning days, that we reacted quite strongly to 2 cases, 3 cases in Monroe County. And here we are with Penny telling us we're up in the 40s and maybe pushing 50 on a daily basis. And we seem to have, from a policy standpoint, just said, okay, it seems like we just accept that now. And I'm not asking for action. I just want to observe that, there's fatigue from a policy standpoint.
Well, and one thing about you're absolutely right. And of course, we have a lot more testing, so we're identifying more of it. If we had had the same level of testing back then, we may very well have had the same or worse numbers. But absolutely, there's lots of ways that it has impacted our thought process.
Any other comments, questions? Okay, next on our agenda is our discussion of communal living feedback. I sent out a summary of a meeting that our task force had. The task force met on October 29th, which is Carol and Bob and myself, and Steve also was able to get in on that task force meeting. And what we did was we heard from the Greek houses on concerns that they had. And I sent a copy of what I heard them say pretty much verbatim. And really what the issues seemed to center mostly around was occupancy. They were looking at asking us to really look at that. Also gathering size, which really wasn't necessarily, it was directed to us, but it wasn't our rule. It was the city's rule that gathering size would be limited and so forth to 15. And that was not our rule, but it was the city's, but they must follow that also. And they talked about, they had several questions and so forth, which the board has answered or can answer for them. The health department, not the board. The health department can answer for them. But basically what we heard was that some of them did very well, and some were not doing so well or had not done so well. And basically the ones that were doing very well seemed to be the ones that were very closely, as much as they could possibly do it, were following the rules. And those that were not were a little laxer or ignoring, or for whatever reason, maybe facility, whatever, they were not following the rules as closely. So that basically, do you have any questions about the meeting that we attended or any comments from the people that were there?
Would just also say that, some of the comments revolved around members living outside the house, and especially can they come in to pick up meals, and if one of the houses, of course, had a very high infection rate initially, and so many of them are in the 90-day period following their infection, and they were one of the driving forces, I think, behind wanting to change some of the rules for them, which I think we've discussed in maybe other meetings as well. But
some of their comments had to do with guest policies. Could people come in, or could family come in, and so forth. But what I felt like as I listened to them was that there was a lot of misunderstanding as far as what isolation and what quarantine and so forth, and immunity. Some of them said, well, if you got COVID, why not go ahead and get it, and then you'd be immune, and then you could do what you wanted to, kind of thing. So it was kind of a misunderstanding. Go ahead.
That too. Okay, they didn't. They seemed like, well, I've had it. I'm protected. We don't know that. We just do not know that, how many different strains there are out there, but their naivety has to be addressed, and we have to give them proper education. And the people on the fraternity on our meeting, we're working in that direction, I think.
Mm-hmm.
Educate them better.
Then we also attended a meeting this morning with IU, and Carol, would you like to go over your minutes? You took minutes this morning.
Yeah, I don't have them really handy because I'm on my computer. But basically, I think some the concerns that we have, Margie addressed in the recommendations that she sent out, which we all received. There were concerns about the ability to, from Margie, basically to enforce the rules, and so we did some things based on that. And with the recommendations, and just it's sort of an overall feeling that these young kids don't understand how they could get it and probably be okay, but how it affects the whole community and that sort of thing. What else was there? Do you have that there, Kay? I know it's by chance.
I do have it. Let me look at it quickly here. It said once again, the ones that had had done the best were the ones that followed the regulations closely. They seemed to feel that our regulations had really been very helpful and were right on target. We did ask the question, you asked the question, and I thought quite aptly, what's going to change for spring semester? You know, we have 2 weeks left, I think, in this semester, and then they start up again in February. What's going to be different with going on there? And they talked about, in fact, the IU people can help me here. There's going to be, each student will have to be tested before they're allowed to come on campus. They're going to have rapid testing, which is going to help somewhat. What else, Dave? You were the one that addressed that.
One thing that came up that I didn't talk about is, even though the campus is opening on February 7th or whatever it is, a fair number of these students are going to come back to their fraternity sorority houses before then. And is that testing going to be available for those students who come back outside the normal time? That was a question actually I thought of after our meeting.
That's a great question. And yes, we will absolutely have arrival testing available for them as they come back. And we are, it's often like herding cats, but Leslie's team, the assistant dean of Greek Life, is getting their plans on coming back and when the different houses will be open. And so we'll have a plan for that as they arrive, Carol. Thank you for asking.
And the other thing that we talked about this morning is how we're asking, we're adding compliance of the students to IU's rules as part of our regulations, so that for the enforcement side for Margie, so that if they don't comply with IU's testing, that we can actually help enforce that.
Anything our IU people would like to say before we begin to look at our regulations, our proposed regulations?
Has anybody gotten the proposed regulation, or other people on the board? Is anybody else, or was it just us?
Kathy or Dave, Leslie, have you seen the proposed regulations? Okay. Michelle, can you put those on the screen?
That'd be great. Fabulous, thank you.
There we go. Can you move it down? There we go, and go to page 2. There we go, first one, okay. Margie, would you like to chime in here and kind of if anything's different or?
Yeah, I can. So the occupancy paragraph states that it would stay at 75%. However, there's an explicit provision that Penny and Dr. Sharp could have exceptions. And I added language to say, if the facilities have to have physical space and the appropriate infrastructure to support and manage expanding capacity, including proper internal controls. So that was something that came up that, there are some facilities, whether they have support of alum or not, depending upon their particular circumstances, they may not be able to handle the increased capacity. So on a case-by-case basis, exceptions could be made. And I can go on if you'd like me to go on, and then we can talk about them in general.
Just going through each of them for us.
Okay. The shared dining and living space, we talked about adding a provision that they could use their dining facilities if they spaced out the tables so that people in the seats, so that people were distanced 6 feet away from other people who are dining, trying to make it a little bit more like the restaurant protocols. The thought was if they can't use their own dining room, they may just go out to a restaurant, and it might be safer to have them eating in. That language, of course, can be modified as needed, but I put in some language for you to consider. Also, that also has a provision that if the numbers of COVID testing results come back and Penny and Dr. Sharp wish to require the to-go meal plan again, they could do that. Shared bathroom facilities and sleeping rooms are pretty much the same, as are the laundry. If you can scroll down, Michelle, to like 6.
Yeah, number 6, Michelle.
The gathering size and guest policies. So I wanted to put in here to remind people that the city of Bloomington did impose a gathering size limit of no more than 15 people. That's the city's gathering size to enforce. Monroe County's gathering size is 50 people. And I had a language that said there's evidence, including contact tracing, that has proven that social gatherings and parties tend to increase the spread of COVID. Therefore, the board will continue to prohibit non-essential guests. I know that that is something that we heard that the Greek students would like to see the guest policy, made a little bit more lenient. However, it's clear that they already have, in a Greek unit, you already have sort of a built-in support system. You have your friend base living with you. And so it seemed to be, at least from a mental health perspective, that they do have support, unlike maybe students who are living in a dormitory where they're in single rooms. So we felt as if the kind of cost benefit analysis, it was better to leave the guest policy as it is than to allow guests and risk the transmission of disease. I underlined that virtual gatherings are highly encouraged and recommended because of those activities that Greeks like to do to get together, those social activities. They certainly can do them via Zoom. You can do initiation and other certain things via Zoom. And so we're encouraging virtual gatherings. Face covering is the same. Quarantine and isolation policies. Again, they have to adopt quarantine and isolation policies, but I changed the language to say that they did have to have isolation space and quarantine practices. But if adequate space was not available in the facility, they should look for an outside facility, and that the health department would work with individual facilities to recommend and develop plans as needed. The language in this paragraph 8 is intended to provide flexibility so that we aren't automatically and always having students leave the facility and go to a hotel or go somewhere else, because that may or may not be the best plan. Again, this language is, subject to your approval and your change as you deem necessary. And I don't.
Yeah,
go ahead.
Say something about that one. Yeah, the concern here is that students, when the whole thing kind of blew up this fall, students did things, positive students did things like get on planes and fly to New Jersey. They, they went home to their parents, and the parents then there were issues with the parents going to work. I mean, there were all kinds of unintended consequences of telling students to go isolate somewhere. And so the question is, are we causing more harm sending them off out into the community in other states and cities, or is it better just to have them stay there, at least among their peers who aren't as high risk as their parents and grandparents and and that whole airplane full of people? So that's what this is really all about. Is maybe there's a balance there that we kind of missed the first time around.
Yep, that's exactly right. I think we're looking to try to reduce harm as much as possible with that language. If you'll scroll down a little bit more, Michelle, the record keeping's the same. Compliance with affiliated rules and regulations. This is a new section, and it says that the board requires residents of any facility who are subject to COVID-19 regulations or rules elsewhere because they're affiliated with an institution, let's say Indiana University, that they need to abide by those rules and regulations as long as those rules and regulations further the interests of the Board of Public Health. Obviously, the Board of Public Health doesn't have an interest in every single regulation that might be put in place, but you certainly do have an interest, and you want to make sure that people who are living in communal facilities are following the rules of their affiliated organization that help with reducing the spread of COVID. So that's in there. And then I added some language to the enforcement section. I added the state code provisions, our local code provision, and just again, to the extent allowed by law, Indiana University will share their information with us. And what we learned and really talked about is it seems as if the rules and regulations as written, maybe with a few tweaks, are getting the job done when they're being followed. And when not being followed, that's when problems happen. So it's not as if the regulations need overhauled, but we do need to perhaps collaborate and work harder at enforcing these provisions when they're intentionally being violated.
And I think the other thing that when we speak with IU, the other thing that was mentioned was that perhaps a little more earlier intervention on the part of the county attorney, i.e. Margie, in terms of warning letters, since earlier on when it seems like things are going south, might help them get back on track before everything falls apart.
Yeah, and we talked about, the exchange of information to make sure that as we get information and in reports that we're sharing that with the board. Might be worthwhile to have the board set up some kind of regular meeting schedule so we can share information. What we heard from our colleagues at Indiana University is that people take notice when there is a letter from the Board of Health or Dr. Sharp, that kind of swift action from local public health authorities seems to get the attention. And so we talked about how do we share that information, how do we meet regularly, and how do we continue to communicate and collaborate and get those letters out from the public health authorities when there's an issue so that we can remedy the situation. And that kind of action certainly is anticipated in Indiana's public health laws. So I think we just need to figure out the sort of practical mechanisms to make that happen. I'm happy to answer any questions.
Do board members have any questions? Penny, I have a question for you. Are you there?
Or are you still here? I didn't know if you stepped out yet.
Steve.
I haven't stepped out yet.
Okay. The regulation number 8. If we go back to the quarantine and isolation policies, and the sentence that says the department will work with individual facilities to recommend and develop plans as needed to ensure public health is not impacted by infected residents. Is that going to create problems for the department?
Well, I guess it depends on how that is interpreted, but I would say to much extent, we're already doing that the university and the health department are working with them. We do have a template. We're working, IU and the health department staff are working on a template so that we have all of the regulations spelled out in that template, and they can simply tell us how they're responding to that. And I think that will be a way to help them develop good plans that meet the regulations that wouldn't necessarily, if it meant that we had to sit down with, 40 some houses and actually develop their plans for them, then that's one thing, right? That would be problematic. But to be able to provide guidance and say, these are the things you need to consider and have, I feel like those are the things that the university and the health department are doing already, and that we're working to improve so that it's easier for the houses. Leslie, you want to add anything? I think that we're on the right track in order to how to help the houses. And honestly, these past few weeks, the university has really done consultations with them individually. So I think we're getting a better handle, and I think the houses are getting a better handle and a better understanding of what this really means. I said this early on, and I believe it's true. I just don't think that in August, they really, and I'm not sure anybody did, comprehended what this really was going to take or look like. And once you experience it, you have a different perspective and a different understanding of what it really takes.
Yeah, and if I can add to that briefly, we have colleagues that meet between our environmental health and safety and MRT, one of our medical consultants that meet with Penny and Kathy Hewitt and their team at least 4 times a week that talk through and are coming up with a plan. I think one piece is just still we need to do more education or awareness. And we actually just talked about this earlier today around what the differences between quarantine and isolation are. I think, and then the other piece of what we're working on is trying to do testing earlier on as they're seeing cases increase in terms of linkages. And then doing the testing and processing the results potentially at the IU lab that we've recently set up, so that the students will receive these results much faster. That way they can isolate and quarantine the close contacts. And I think the goal will be to mitigate the spread. So working on a lot of strategic planning around that, and just want people to know the hours that Penny and all of our colleagues are putting into work with these communal living facilities and with our students to try and prevent the spread among those living in the houses, plus to the greater campus community.
Yeah, I see this as the greatest challenge, is what to do with those affected individuals in the houses that move out. You know, if they're moving into the community, that's not good. If they're going home and flying home on an airplane, that's not good. That's the problem I'm seeing with number 8. And when I read that last statement, Penny, I thought, oh no, is that asking Penny to start finding hotel rooms? You know. So thanks for clarifying that, Margie. Any questions from board members? Michelle, I think you can take away the document now. We're back in line. Okay, board members, what do you want to do with this document?
I move we accept it as written.
We have a motion.
Second.
Okay, we've had a motion and a second. Any further discussion? If not, I'm going to call for the question. Okay. We have a motion and a second. Now let's vote. George?
Yes.
Mark?
Yes.
Steve?
Yes.
Carol?
Yes.
Carol? Bob?
Yes.
And I vote yes also. So those are updated regulations. Okay. Thank you for all your input, everyone.
Margie
Next.
for putting it all together. Margie did a great job putting this one together. It was great.
She sure did. She sure did. As I said, Margie's really worked hard today. She's put together several documents for us. We appreciate her help. I don't know how we get done without her. So thank you, Margie. Next on our agenda, I think, is the approval of contract for compliance order or officers. Penny, are you still here? Yep, I see you. You want to talk about the compliance officers?
I will introduce this, and then I may let Margie kind of fill in, and then I'll pop out and pop back in. So one of the things that we have heard is we have been following up on complaints about masks and distancing and crowds in restaurants and bars, those kinds of things, is how difficult it is to ensure that patrons are following the rules. And specifically masks is the big one. And we talk about this constantly, and we have tried very hard to, as we always do, to get voluntary compliance, to not have to issue fines and close facilities. And we talked last time about some of the difficulties and the challenges with some of the restaurants and the bars. And we've tried to really listen to what people have told us when we have been following up on those complaints. The commissioners offered, and we've had this has come up several times, so it wasn't a first time, but it came up as an idea. Do we need compliance officers late at night, like on the weekends at the busiest times during some of these bars to assist the facilities, the establishments in following up on those complaints, or just making sure that people are being compliant. So the commissioners have offered to kind of do a trial, if you will, of some compliance officers, hiring a security team to go in on behalf of the health department, is essentially on our behalf, to assist the facilities, the retail food establishments, sorry about that, and help them with people who are standing and not staying seated, who are not complying with the mask regulations, those kinds of things, distancing, and just offer that assistance across the county. And so this is essentially a contract that would run through mid-December for the weekend hours, like Thursday through the weekend, for hours, I think it's 9 or 10 p.m. until 3 a.m. For 4 to 6 officers that would help us and act as agents of the health department. So the two things that are upcoming, and Margie will kind of talk more about these if you have questions. One is, would you approve this contract? The commissioners did, pending your approval. And then there's a change to the regulation that would recognize them as serving on our behalf. And we think that it will be a plus. We'll get more information, observation on, is it needed? Is it really not needed? And I think that that data then can help drive future decisions about what's needed.
Yeah, and if I can, I'm going to jump in here as well and back up what Penny said. This came about after we had talked to several bar owners and restaurant owners who, you know, expressed frustration with, you know, they're doing their very best to try to get paid to comply. This isn't their expertise. They're used to running bars and restaurants. They're not used to enforcing our health orders, nor is that their primary, you know, responsibility. So we talked about what we might be able to do to help, and would they object if we were to hire enforcement officers to, you know, walk through their facilities, to kind of do a circuit and check for compliance, kind of be the health departments and the health boards' eyes and ears out there late at night. They also said they tend to have more issues the later the night gets, and frankly, the more people drink. So that's how this idea came about, and it is intended to be done on a trial basis. To those people who would object about this public money being spent, I would say it wouldn't be necessary if people would follow the rules. If people would comply with the regulations that are in place, it wouldn't be necessary to spend this money. But we do end up spending time and money trying to get people to follow rules and regulations when they're not inclined to do so. And that's only made harder when people drink alcohol. And so we'll see how this goes. I would encourage you to take some public comment. I think that as I looked at the attendee list, we have a commissioner on the call, and there may be some other members of the public. I know some members of the public who commented earlier may have input, so you might want to hear from them before you take a vote on this.
Thank you so much. I can't see those people that are online, and so anybody that has their hand up. Michelle, do we have people with their hand up right now? We'd love to hear your comments.
I did not see any hands raised at the time. So sorry, one just came up as I said that. All right, Christina Armour is again. Would you like me to put the timer on the screen?
Yes.
Okay.
Christina, go ahead.
It's Mike. As far as the compliance officers, my only concern when I talked to Penny, and I think I talked to Margie too, was that it's quite expensive. I don't know how much, are you guys going to be able to train them before you send them out? I'm guessing somebody will be, to what they're, you know, because I assume they're from a security company or something like that.
Yes.
I know they're really expensive. We welcome anytime that we can get the health department eyes into our business so that they can see, because we work different, we work opposite hours. So anytime we can get the the Board of Health to watch or see what we're doing as we're doing it, then that's good for us. We like that. That helps us communicate. So yeah, we're all in favor of it.
Thank you so much. That's so good to hear. Anybody else, Michelle?
But to me, it just takes away the complaint that we are not uniformly applying the rules, which I think is what the implication is by saying we're only enforcing it in smaller establishments and not in larger establishments that might be chain. I mean, I've seen these actual complaints. So if we have somebody to enforce them, at least I'm hoping that they're going to be applying this evenly to all establishments and visiting all establishments, not just small places. So
Good
that's my
point.
only concern. Yeah.
I think the major thing to focus on here is this is not meant to be punitive. It's meant to help with educating. I'm sure there are establishments that aren't sure of how to handle certain situations, and there'll be somebody there to ask. So I see it as a very positive thing.
I hear Dr. Pritchard asking a question. He's asking how we will be assured that this is applied with justice and uniformity. I mean, I don't know that I did not look at the contract with eyes specifically to that, but that's more of an operational thing that maybe, we as a board should just express to Penny and the staff that, make sure as this is operationalized, if in fact we do this, that it's done as Dr. Pritchard described.
Yeah, I absolutely hear that. And our goal is to, make sure that we are evenly applying the rules, we're fairly applying the rules. If there are establishments that are, having more issues than others, obviously they may get more attention. But yeah, it's certainly not our intent to focus on large establishments and not look at the smaller ones, because there can be issues there as well, some of the smaller bars. And it won't just be within the city. I know there are some establishments in the county as well, and that will be looked at. Right.
Just like our food inspection process, there's a schedule of who gets visited, and I think that might be kind of a good uniform approach, is to have a process that's been predefined rather than just ad hoc. So I leave that comment just in the lap of Penny and staff.
Any other comments?
Training will be important.
I'm sorry, George?
I said training will be very important for these officers.
I think you're right. Anything else you want to focus on? Well, board members, what do you want to do with this order or this contract?
We do have it available if you want Michelle to flash it up on the screen.
Do we need to flash it on the screen? Has everybody seen it and read it?
Sent it out earlier today, didn't you?
Mm-hmm.
I think I looked at it.
Does anybody feel it needs to be flashed up on the screen?
I read through it, and it appears that all the insurance policies are in the proper place so that we're not liable. And so anyway,
contract.
Yes. I would move to accept the contract as it's written.
Okay. Anybody else want to second that motion?
Second.
Carol, you seconded?
Yes.
Okay, let's go for a vote. George?
I agree to accept.
Mark?
Yes.
Steve?
Yes.
Carol?
Yes.
Bob?
Yes.
And I vote yes.
One thing I also would point out is that there is a tracking mechanism, kind of a dashboard that the company has that we'll be able to access to. So they'll be tracking their progress and, through the evening as it goes through the night. And we'll make sure, I know that health staff will be in communication with them after each night that they're out. But I will make sure that Penny has, that we communicate the training is important, and you want to make sure that we're uniform and fair in the enforcement activities.
And the board is kept up to date on any problems or.
Yeah, and that's one thing I think towards the end of the meeting, when you guys are talking about when you want to meet again, you guys should talk about how often you want to meet so that, information, if you want information sent to you or whether you want to meet on a regular schedule. That's just something for you to think about again later in the evening.
Okay. Well, Margie, I know you've been busy doing orders or proposed orders all day, and I had another one that came across a few minutes ago before this meeting for discussion only. Do you want to talk about it tonight?
Yeah, if you want to, and I have it. Let me see if I can. I'll find that email and I'll send it to Michelle, and she can flash it up on the screen.
I thought she already had it. I'm sorry.
I want to make sure. I don't know if she does. I'll have her look here in a sec. If she's got it, that's great. If not, I can send it to you. But one of the things that we talked about was looking. It's been since July. You guys have not updated the kind of community-wide regulations regarding bars and restaurants since July. So I looked at that regulation and started just modifying some conversations we've had and thought that it may be something you want to revisit at least for discussion tonight. If you may not vote on making the changes, but at least start talking about it and thinking about when you want to update those, because things have changed, obviously, since July. Michelle, do you happen to have that, the one that was sent out? Let me look at my sent file, and I will send it to you.
I'm not even sure all the board members have seen it because it's something I just found a few minutes before the meeting.
Yeah, I wasn't sure. I'm going to send it to Michelle and she can put it on the screen. I wasn't sure if this was even, if you really wanted to tackle these regulations tonight or if you just wanted to talk about it. So Michelle, I just sent you that document. And if you, when you get it, if you will flash it up on the screen, that'd be great. But it's going to look very much like regulations in July with edits. And I put some things in there for conversation after talking with Penny, and I know Nicole Wagner had made some suggestions as well. So again, tonight I think it would be worth your conversation. And if you decide not to make any changes, then just pick a date when you do want to meet again to make some changes.
Did the governor not have a restaurants and bars that was wide open back in August or September, and the rates went up, and we had a more restrictive regulation? I would lean to that direction just because of the results in Indianapolis and statewide. Is that what you're supposed to say?
Yeah. I mean, what you say is true, right? We've been stricter than the state, and our numbers are obviously better than the state. This keeps pretty much everything the same, except it did open up bar top until 9 p.m. And then had, a bar service in the form of a line. I heard tonight, it was interesting to hear from a bar owner that said they really do not want bar top service opened up. I don't know if that's uniform among bar and restaurant owners that they don't want bar top service. We've heard from a lot of bar owners saying, hey, they do want bar top service. So Michelle says she has it and she's getting ready to put it up on the screen here in just a minute. But what I wrote is, and Nicole had some ideas about, putting plexiglass up as a barrier between the bartenders and the patrons. That was a comment that I don't think is incorporated into this. But that kind of physical barrier may protect bar staff. That may change that owner's perspective. Okay, so here it is. Again, for discussion purposes only, I did not put a date in it. Michelle, if you'll scroll down a little bit, I think that it's highlighted where the changes are. So if you'll scroll down, you see some highlights. So there, so gathering sizes enforced by Monroe County, it's 50 people. I wanted to make a note here that the city of Bloomington has put in place a 15-person gathering size limit subject to city enforcement. Again, gathering size is enforced by Monroe County. If you keep scrolling down, Michelle. There we go. Restaurants, bars, and nightclubs. Now, I think Nicole had suggested after I did this draft, she had some good suggestions, making sure we define nightclubs in music venues or differentiate between them.
Margie, she said restaurants, bars, and entertainment music venues.
Okay. And do you have her other changes? Can you read through her other changes?
I do have her document in front of me. I can read it and you can see the difference if you look at this one. It says restaurant, bars, and entertainment/music venues must have and require tabletop seating for all patrons and must require patrons to remain seated at tables. Parentheses, no dancing, no standing, or congregating in groups, end of parentheses, and may operate bar top service at 50% capacity until 9 p.m. if a plexiglass shield is put in place. Okay, over the bar service is permitted for ordering purposes only after 9 p.m. with a plexiglass shield in place and must be in a designated area. They must follow additionally meet the following requirements. A, they are encouraged to use outdoor seating as much as possible. B, clear floor markings must be put in place to indicate where a line may begin, 6-foot markings where the line must end in order to keep patrons safely distanced from other seated guests. C, groups of seated patrons and those patrons standing in line for bar service must be spaced at least 6 feet apart. D, party size must be limited to 10 people or fewer at a table. Back-to-back seating with plexiglass does not take place at back-to-back seating with plexiglass does not take the place of 6-foot social distancing rule. E, standing is permitted in entertainment music venues at a minimum of 15 feet from the stage with 6-foot distance markings clearly outlined on the floor. Total capacity for the entertainment and music venues is not to exceed 50%. And then the air ventilation is the same. So I think that's one we're really going to need to look at.
Yeah, I agree. And I think
they can talk about.
Michelle, if you'll scroll down, are there any other changes in this document that are highlighted? I think there you go. Just this section 11, if you change nothing else tonight, I would recommend that you do authorize this change in paragraph 11 to the existing regulations, which it says that your regulation can be enforced by any local or state law enforcement agency or any agent authorized by the County Board of Health, Health Department, or Monroe County Board of Commissioners. So the contract that you just approved would allow these people to enforce that. And I think that's it. If you scroll down, Michelle, I think that's the last change, and you could take this one off the screen. Yep, that's it.
So we could vote tonight on adding that about the ages. I'm doing something that causes feedback. We could vote on that one tonight about the enforcement officers being added, but not vote the rest of it and work at another time. Okay.
The only comment I had from and again, since you were reading it out loud and we didn't see the writing, and I'd like to see the writing before we actually vote on the whole thing.
Absolutely.
With 10 people, I would say actually seated in individual chairs at the table. Because, it doesn't, I think that makes it very specific. We don't want people like piled into really small groups at a table.
One of the things I thought about that I would like to see in the order is that people keep their mask on when they're doing ordering. We heard that tonight, that, people take their mask off and the waitress or whoever comes up and then they order, and it puts them at risk. So they need to keep that mask on when they order and don't take it off until their food arrives.
It would be great to recommend that people in restaurants are only removing their mask when they're eating. That would keep those staff safer.
So do you need somebody to move that we accept that one thing about the enforcement, because since with the compliance officers, we need that in there. And I would like to vote on that tonight. And so I move that we make that one change tonight, and that we table rest of it till we get more specific language and iron out the language to our next meeting, whenever that might be.
And I do think we need to update this.
Yeah.
So
If that's a motion, I'll second it.
Okay, George has made a motion, Carol? No, Carol has made a motion, right, Carol? Do you want to restate it?
I state that we update the ordinance with the one paragraph about the agents that can enforce as written, and then table the other changes until our next meeting.
And George has made a second, correct? George?
Yes.
Dr. Sharp, did you have something you wanted to say? I saw your light come on.
Oh, no,
Okay.
that's,
All right.
I'm total agreement with this.
Okay, we have a motion and we have a second. Okay, let's do roll call.
A clarification, this enforcement behavior, we're going to hire an outside agency to do this enforcement, not the city police. Do we have someone in mind we're going to use for this?
Yeah.
Okay, so it's all underway then. Thank you.
Yeah, it's a security company, and the lead was a former City of Bloomington police officer. So he has familiarity with, local rules.
Penny, you're muted.
Thank you. Sorry about that. The other thing that I will add, when we did talk with them, we had a really good conversation about, this is about, again, that voluntary compliance and not coming in with a heavy hand, but their job is to assist the business in getting that compliance. And with that, they'll be able to give us feedback on what the struggles really are at that time. And I think that feedback will be helpful. And we will also be supplying them with masks. So if they encounter someone that says, I forgot my mask, that's why I don't have it on, they'll be able to say, well, here you go. And in the survey, I don't know if you talked about that, but in the survey, it was split in terms of people that thought this was a great idea and people that thought it wasn't, and undecided. But several that I talked to have really said, we need help. And so this is an opportunity for us to give them that help, see how it goes, and go from there.
I'm just getting a computer message that I can't really figure out here. Penny, while you stepped out, one of the things the board wanted to point out is we thought the training of these people would be very, very important. And also that we wanted to make sure that, as I'm sure you will, that it's applied evenly, that, it's not one bar singled out over others and so forth.
They will have a list of all of our bars and restaurants, and throughout the county. It will not just be downtown. It will be evenly distributed, and they'll be in and out. It won't be like they'll necessarily be in one place all night, right? They're not going to become employees for those businesses. They will be traveling, if you will, and visiting establishments throughout the evenings. So if they're not in your establishment tonight, they might be there tomorrow night or next week or at another time. It will be random.
Okay, did we vote on that? I'm sure.
No, we didn't. We didn't vote. We did not vote.
No, we did not vote.
Okay, we had a motion by Carol. We had a second by George, and now we're ready to vote. Okay, George, I think he stepped out. He told us he had to step out earlier for a meeting. Okay, Mark?
Yes.
Steve?
Yes.
Carol?
Yes.
Bob?
Yes.
And I vote yes. So that number 11 that was in.
We'll work on making those other changes and incorporating Nicole's thoughts. I'll work with Penny and her staff tomorrow, and we'll get that document out to you before the weekend.
I just would like to say that I was trying to listen fairly closely, even though it wasn't written down, to the changes. And I think they did mirror pretty well what we had said in previous meetings that we wanted to see happen. And I was happy to hear that if they were in line to order drinks at the bar, that they were maintaining a distance from the people that were seated, and that, that the end of the line would be marked in order to accomplish that. Because that's originally the reason we wouldn't allow them to come to the bar to order, is because there was no way for that line to stay distanced from the people seated in a seated position, which of course most of them are going to be unmasked.
Yeah, and I think also, the idea, if you're standing in line, you have your mask on.
Yes,
when you're at your table eating or you're drinking, right, but when you're in line, you have your mask on.
Okay, so what we're going to be doing at our next meeting is looking at this document more closely. Is there anything else tonight? Any comments or anything else that we've not done?
One last question here. When we had a meeting, everybody agreed on 25 and the mayor went to 15. So I think we went to 25, not 50. He did not go from 50 to 15. Everybody on the phone agreed at 25, and then after it was all over, he said that's really great, but I'm going to 15. So I think we're at 25, but I'd have to look that up.
Yeah, no,
Penny, are you?
I'm here. That I think that was a different discussion. The regulations have 50. I think what you're talking about is some of our weekly discussions, and that we had contemplated, would we go lower or not? And the city went ahead and put in 15.
Yeah, we were going to go to 25, but you're right. It was not a reg, not at all a reg. Anyway, that's a consideration. And it's something in the background there.
I'm sorry, I just lost everyone. My computer's wanting to update and I can't override it. So you can't see me, but I know you can hear me.
We can see you.
We can see you.
Oh, you can't see me?
You're seen.
I'm in Venice. I'm actually seeing a shot of Venice on my computer.
Oh, nice.
Anything else, Penny, that you can think of we need to talk about tonight?
I don't, when you're going to meet next.
Yes, that's exactly.
That's our last thing. Okay. Well, we know we need to look at the general regulations that we just got the document, and you'll make sure you send Nicole Wagner's to everybody too, won't you, Margie?
I sure will. I'll actually incorporate her changes and then send it out for everyone to look at.
Okay. And then we'll have a discussion on it at our next meeting and maybe approve it or change it.
When is it that the compliance officers are starting? And was that in the contract? I can't remember. I read it, but I can't remember.
It was in the contract, but I can't remember exactly. It's soon.
It would be this weekend.
Yeah.
Oh, so we would, if we met in a couple weeks or so, we would have some feedback.
I'd love to have that.
Yes.
Yeah. How about we just do it 2 weeks from tonight, the 19th?
I'm not
Yes.
sure. I'm not sure I'm going to be able to attend that meeting. I have a surgery on the 16th. So that's close.
We could always send out a summary.
Right.
So if you want to go back to Tuesdays, Tuesdays would be the 17th. I know we did this Thursday because there was a conflict on Tuesday, so.
I certainly don't have to be there. Somebody else can
Are you gone the whole week? Or is
No,
it that day?
my surgery's the 16th and it's an overnight, so I won't even be
And
home.
I have a conflict for the 17th, so I can't be there.
How about the 19th? 19th? Thursday, 19th?
That works for me.
I'm available.
I can.
Yeah.
Okay.
Does that work for you, Margie?
I have a conflict the 19th, but I can have another one of the county attorneys sit in. So that
Another day. I think you're kind of key. You're important to be there. I think I would like you there. I would like to have Margie there. So
It's very iffy for me.
19th. What, does the 24th, which is the week of Thanksgiving, is that bad? That's bad for people?
Well,
Not doing anything.
I have a meeting that night too. So
how about
those 2 Tuesdays, yeah.
It doesn't have
how
to be.
about Wednesday the 18th? How about that one?
I'm available.
I can do that.
That works.
That works for
Good,
me.
Margie?
That works.
Ooh, I think we may have a day. Wednesday the 18th? And
I wouldn't be available until about 6:15 or 6:20 because of class. But I should be able to join.
Well, as long as we have a quorum, and George isn't on now, and
What about
Ashley's not here. Ashley's not here, and I won't be, I don't think, on the 18th.
Oh, okay.
I don't mind meeting a little bit later, like 6:15. I mean, that's not a problem.
What about, you know what, I will say that there are bars that are really interested in getting that kind of bar service going. What if you had just one weekend under, of information and you met
next Thursday?
Next week. Now, I have a conflict next Thursday. What if you met, do you guys ever want to meet during the day, like on Friday the 13th? Hope nobody's superstitious. Do you meet during the day at all?
I might meet during the day. A light schedule.
Like Carol said, we're just old people. We're at
We're
home.
old people hanging around. How about Friday afternoon?
I can meet during the day. I don't know about everybody else.
I can. I certainly can.
What about, I know Penny has a standing, I don't know, Penny, what does the 13th in the afternoon look like?
Yeah, I have the 1 o'clock press conference. Everything else on the 13th, ideally, I would say if it was after 11 and then not 1 to 2. But I
This
can
should be a
make
relatively short
anything
meeting.
else work. Yeah,
I mean, it shouldn't be a really long meeting, right?
I wouldn't think so.
3 o'clock work?
You want to do
I'm
like
sorry,
11?
I said,
Yeah.
would 3 o'clock work or do you want to do earlier? I have a 10 o'clock that'll last till about 11:30.
I could do it later in the day. 3 o'clock's fine.
3's for me. 3's okay for me.
Okay.
Let's board 3 o'clock?
The 13th?
Yeah.
Friday the 13th at 3.
Friday the 13th at 3 o'clock or 4 o'clock?
You said 3, right?
3, okay.
You'll also have another they'll have that Wednesday the 12th that night as well, the information share. Would you like, if possible, to have anybody from the I don't know if it is possible, but do you want anybody from the security company on the call?
It would be great if they could.
It'd be great just to get their feedback about how it's going. That'd be good.
Okay.
Cool.
Okay, so our next meeting will be on the 13th at 3 o'clock, and I'll see you then.
Great. Thank you, Kay. Thanks, everybody.
Thanks,
We
Kay.
are adjourned.
Thanks for your hard work today, Margie. You did awesome.
Just a comment. I went to the Optum clinic for screening today, and that's a wonderful piece of
Really
cake.
nice.
Quick in and out facility. I highly recommend that.
They do a great job.
They do great.
Mhm.
It's quick.
Yep. All right. Thanks, guys. Have a nice
Thank you.
evening.
Bye.
Bye-bye.
Bye, guys.